Hi, I am Dr. Bindumenon. I am neurologist at Apollo Specialty Hospitals, Nellore. Today we are going to learn about diabetic peripheral neuropathy. Peripheral neuropathy is a damage to the nerves due to any reason, of which diabetes is one of the most important causes. When the sugars are not under control and chronic diabetes, that is long-standing diabetes with poor sugar control, can lead to damage to the nerves. In fact, 60 to 70% of patients after a decade of uncontrolled diabetes will eventually develop diabetic peripheral neuropathy. It has been said that around 27 to 32% of South Indian population are presently suffering with diabetic peripheral neuropathy. What are the types and what are the symptoms? The diabetes can affect your nerves, and it could be motor nerves, it could be sensory nerves, or it could be autonomic nerves. If it is sensory nerves, the patient feels a lot of pain, burning sensation, pricking sensation, tingling sensations, or it can be just numb feeling, that is loss of sensation. Sometimes the patient cannot even feel the slippers and the slippers slip out while they are walking, and this can lead to falls. Sometimes patient feels that he is walking on cotton wool and he cannot feel the sensation of the floor or the ground, and that can also lead to falls. These are the sensory symptoms which the patient can have. The motor symptoms could be due to weakness of the foot. Either the toe is not able to move up or the foot itself is not able to move up, and again this can lead to falls. Autonomic symptoms, we can say there can be loss of sweating. There are certain deviations from the normal physiological mechanism. In diabetic peripheral neuropathy, the loss of sweating can be there. All of these conditions, in some patients, they go unnoticed because they are not symptomatic of the same, but in some patients it can be very severe and the pain can be intolerable, requiring lot of medications to control the peripheral neuropathy symptoms. Now, what can one do to see that the peripheral neuropathy does not happen? The risk for having a peripheral neuropathy is more commonly seen in older patients, just because they have got some other diseases as well. They could be on some other medications as well. Poorly controlled diabetes, not going and checking your sugars properly and not meeting your doctor regularly. If one smokes and takes alcohol as well, then that can also lead to more confounding factors, puts you at more risk for having a peripheral neuropathy. Watch your sugars carefully, go and check your sugars carefully, keep them under strict control. Take care of your foot, see that there are no ulcers, there are no sores, there are no bunions, there are no corns. See that you use properly fitting footwear, because tight footwear, because as we said, it can be a numb foot and the sores can go unnoticed for the patients. Take care of your foot, wash your foot properly and apply cream and then sleep off. All of these symptoms, if you do regularly and have a check on your sugars, you can, to a large extent, take care of diabetic peripheral neuropathy. Keep your sugars under check and have a healthy life. Thank you.